Tonight we have the privilege of having an opportunity to sit down with Dr. Brian Abelson and talk a bit about the motion-specific release, the hands-on courses, and these incredible protocols that really do a wonderful job of helping to alleviate soft tissue dysfunction with your patients. So thank you so much, Dr. Abelson, for taking the time to sit down. I know you've had a very busy day today, and we're very delighted to have an opportunity to chat with you some.
Pleasure to be here, Jessica.
Thank you. So if you could tell me a little bit about currently, like how you practice and how your practice has evolved through using MSR. So what does it look like in a typical patient visit for you?
Well, my typical patient visits can vary greatly because obviously a lot of people come to see me because they have a particular dysfunction or they're in pain. Other patients are coming to see me for sports performance. Actually, a real cross-section of individuals and different demographics in terms of age. So I specialize with a lot of younger people in terms of athletes, but also it could be dancers, it could be right up to geriatrics, just helping them to be functional and helping them to return to actually activities they've been away from for a long time.
Nice. So as your practice has evolved and as obviously you have probably primarily treated utilizing a lot of soft tissue, I'm sure in the past, how has your practice evolved since really honing in on the MSR protocols, and how have you found that that has made a difference in what you can achieve with your patients?
You're right, Jessica. Everything does evolve. I've been involved in a lot of different modalities in terms of treating soft tissue, and they're all great. But there's always ways to improve, and there's always ways to get better results, and that's what we're always striving for. So as we've gone through something, we've always looked at better ways in terms of not injuring ourselves, for example, the type of techniques that we use, and also getting results within a short period of time. Sometimes I'll be working on an athlete, the patient will come in and they'll say, look, I'm running the New York Marathon 3 weeks from now. You got to help me with this injury. And so sometimes the pressure's on, you got to do what you can. I work with different sports teams, and when I'm working with runners or different track athletes, they're looking for a competitive edge. So that's a little bit easier because you've got a demographic where you can actually do a lot of measuring to see a functional change. For other people, they're just concerned, hey, I'm living in this 2-story building and I want to be able to get up and down my stairs. So my practice has changed a lot because when I first started in practice, I was dealing a lot with joint dysfunction. I'm a chiropractor. So obviously that was one modality, which I've never given up, and I still practice as much chiropractic, but I've integrated multiple soft tissue techniques and fascial modalities into what I'm doing. And the results have really, it's been an exponential increase in terms of our results. It's quite incredible, actually.
Wonderful. So let's talk and dive a little bit more into some of the soft tissue modalities that you utilize. I know that you said, throughout your career, you've been involved in a lot of different soft tissue. I'm sure you've attended a lot of courses, as many practitioners have throughout their career.
Right.
I'm sure there's been a lot of different techniques under that spectrum that you've utilized in practice.
Yes.
What did you feel like was kind of a missing component, and how did MSR really come about?
One of the missing components I found is sometimes with certain modalities, you'd be dealing with one structure or a couple structures, and they really weren't addressing the kinetic chain that well. We have a term that refers to a tensegrity, or a localized area of structures that are connected. Now, we deal with those structures, but I realized in a very short period of time that I was probably missing the picture because I had to actually start dealing with more fascia, connective tissue, nerve entrapments, joints. We think of a musculoskeletal technique. Quite often, musculoskeletal techniques will only deal with, for example, the soft tissue or the joint. But it's imperative we deal with both. It's imperative that we actually look at the larger picture and then bring into focus the fascia, the connective tissue, as it relates to a larger area. Thomas Myers, for example, talks about either we've got 600 muscles in the body, or we actually have just one muscle connected by a fascial connections. So I started looking at things in terms of, what's the history of this individual? What is it that really makes this? What imbalances have they had? What previous injuries have they had? So I started getting a lot more in depth. And as soon as we started to get a lot more in depth, then our results changed substantially.
Wow, nice. So I know another thing that I've heard from a lot of attendees of the MSR courses that they really appreciate the fact that you take clinical creativity into consideration when it comes to the courses. And you really try to treat each individual patient in a way, like you were saying before, that really looks at their past history and past injuries. How does that kind of interplay with the clinical creativity? And how have you found that that's really improved the outcomes?
Well, the interesting thing about that is a lot of techniques say that they treat specifically for the individual.
Hmm.
But in reality, um, there is no one model or one paradigm that fits all people. Not everything can be cookbook.
No
So,
cookie cutter, yeah.
correct. So when cookie cutter, when we actually look at something, uh, well, like I said, I've done a lot of different modalities. I've done the training under the Stuccos in Italy, which is just great. I mean, amazing studies on, and they come up with their fascial lines. And Thomas Myers has his fascial lines and other modalities. And the interesting thing is, they're all correct.
Hmm.
But you start to realize after a while, when I had a conversation with one of the anatomy instructors at the Fascial Congress in what took place in Amsterdam, I remember talking to this gentleman who was one of the leaders in the anatomy section there at the university, and he was saying that what creates lines is the surgeons or the scalpel of the anatomist. So in other words, for each individual, we have different thickenings, we have different areas that start to remodel, and there's actually dysfunctional lines that develop. So when I started looking at it and not expecting where something would go from a three-dimensional perspective, but realizing that structures I never thought would ever be involved are involved, and I started looking at that individual as a specific paradigm. I actually had to create techniques sometimes for this individual. That's where the creativity started to come out. That's where I looked at it and said, this is a really powerful modality if I don't try and fit this individual into this paradigm. And then you come up with some really innovative solutions.
Nice. So in kind of in following in that same line with those innovative solutions, um, the course is called Motion Specific Release.
Yes.
What does the name mean, and how does that relate back to what you experience in that hands-on course?
Well, obviously the M is for motion.
Hmm.
The S is for specific to the individual.
Hmm.
And the R is the release of things that will actually inhibit functional changes. So basically, we're releasing something which is inhibiting the individual from performing an action.
Hmm. And now, when you attend a hands-on course, what is
Yes.
that experience like? What can a practitioner expect to, number one, experience during that weekend, but then also what can they take away and immediately implement into their practice on Monday?
There's a lot, and that's one of the things in terms of feedback we get back from people, is that they are able to go back to their office and actually utilize the techniques they're doing. So whether we're dealing with a wrist, arm, shoulder injury, whether it's a nerve entrapment syndrome, something for the back, these are things that they can actually put into practice almost immediately. And in terms of resources, we really work hard at actually, if we're dealing with the shoulder, talking about a diagnostic algorithm. So one thing they can do, we made a lot of anatomy videos they can go through and review, but we also talk about key orthopedic and neurological tests. We talk about indications, contraindications. So we consider ourselves to be conservative therapy, but conservative evidence-based therapy.
Mm-hmm.
So after we get the diagnostic component together, we give them a paradigm that deals with, we call basic structures. We give them the basic tools to actually deal with an area. And then we start dealing with what we refer to as tensegrities, or areas that are affected in a localized area. And then we give them a paradigm where they can actually move on from that into what we call fascial expansions. Then we start to see how one area of the body may have affected another area based off of previous history of injuries or muscle imbalances.
Wow. Yeah, no, I know that's powerful. I've seen and I've heard before how you can have an old ankle injury, and then that can cause you to have, hip dysfunction all the way up into the shoulder. So
Right.
I think it's incredible that you are looking at the full kinetic chain and really not just treating the site of pain and dysfunction,
Right.
but actually, working that up the chain. During these course weekends, I know that it is split into an upper course weekend and then a lower course weekend.
Yes.
What are some common types of conditions? I know you'd mentioned nerve entrapments. What are some common conditions that a practitioner can learn how to treat with the MSR protocols?
Right. So if we're doing an upper extremity course, for example, we look at obviously neck pain, but headaches, cervicogenic headaches, TMJ. We have a 10-point TMJ protocol we take them through, dealing with both external and internal muscles. Really effective. We found a lot of people that have chronic migraine headaches who really thought there could be no resolution to their problem. And then we start working through these different protocols, and it's really, really quite amazing. We also get into upper extremity nerve entrapment protocols. So we start looking at the radial, the median, the ulnar nerves, some common things that come up with repetitive strain injuries or anterior posture. Also respiratory dysfunction, which is something that a lot of people experience, but they don't really realize the effects of this and how that actually affects their nervous system, creating sleeping problems, anxiety, just increases in levels of cortisol in the system. So it actually promotes pro-inflammatory reactions. Obviously upper, for sports injuries, golfer's elbow, or tennis elbow, carpal tunnel syndrome, a wide variety of musculoskeletal conditions.
Wow, no, that sounds wonderful.
That's just the upper extremity.
So then I'm sure, with lower extremity, likewise, I know that I've heard a lot about the plantar fasciitis protocol
Yes.
you all have, as well as, the gluteal nerve entrapment issues with low back pain. Obviously, knowing that low back pain is by and large one of those huge things that a lot of practitioners are seeing in their practice. Tell me a little bit about how MSR kind of addresses those type of conditions, and what kind of results you're seeing in your patients with those.
Well, one of the things, as you say, looking at the kinetic chain, so we teach practitioners how to do a certain level of functional analysis.
Mm-hmm.
For example, we may have them do a functional squat test,
Mm-hmm.
and then we'll see that the person comes in and they have sciatica, but all of a sudden we realize their gluteal muscles are not engaging. And this could be for multiple reasons. Either they have really tight hip flexors, or perhaps they have been sitting for a long period of time and the adductors on the inside of their leg are getting very short and contracted, consequently turning off the gluteal muscles, and they start to lose stability in their hips. Well, if you're trying to deal with a low back problem and you don't really have your primary shock absorbers actually engaging, you're spinning your wheels. You're not really making traction and moving forward in terms of a resolution. So we look at it in a very logical way, analyze it, and then we start to look at not just the localized area where it hurts, but the antagonists, the synergists, kinetic chain relationships with other muscles in the area. And we look for some really good functional changes. And we expect good results within a short period of time. And the majority of the time we see them.
It's wonderful. So talk to me a bit about how MSR, I know there are so many different, technique courses out there.
Yes.
But what I hear from MSR practitioners, and what I've heard even through this conversation, is that MSR is really more of a system or a protocol as opposed to just being a specific technique.
Right.
Can you talk to me a little bit about that and why you chose to do it as more of a system and a protocol versus, a technique course?
Well, one of the things that I like to emphasize is that we're all standing on the shoulders of those who came before us. Mm-hmm. And I remember, just recently, Leon Chautoy passed away. A very interesting gentleman. I think Leon was in his 80s. He wrote 80-some books on musculoskeletal injuries. Really amazing man. And I remember sitting down with him at the fascial conference. And I just introduced myself and started talking to him. I said, hey, I've read all your books and different things. And, first thing he said is, oh, you're doing this technique. How is this different than Eiderall's pin and stretch? How is this different than this? And I said, I really don't know. I said, I know some of the history. So something I started to really delve into is, and I started to understand a lot more as my career progressed too, is that when we actually take diverse ideas and start to bring them together, we actually start to formulate new ways of approaching a problem and actually even improve on what's already out there. So with MSR, we're taking the fascial work, the joint mobility. We're looking at, with the fascial expansions, combining acupuncture points at certain points that come out. Some of the research from the Fascial Congress. There's a Fascial Congress actually coming up in November that I'll be at. They hold it every 3 years. This time is in Berlin. But it's everyone coming together in that multidisciplinary perspective, putting their ideas together that creates something very powerful. And that's what we work really hard to do, is actually put something together that's always growing and developing. We're always looking at our course and saying, when we teach this course next time, we want it to be better than the last time we taught it. and it is.
Right, that's incredible, and I think that that rings so true, just with the musculoskeletal realm as a whole, and I guess if you took it even out to a larger profession, which is physical medicine,
Yes.
because as science evolves, as new research comes out, it is important, from an education standpoint, to stay up to date, and for practitioners to continue challenging themselves with new courses and new opportunities to learn and grow. And speaking of which, in terms of growth and moving forward, who are some mentors that have really impacted your career? I know you had mentioned Dr. Chaitau, who unfortunately, just passed
Yes.
not too long ago.
Yes. Yeah.
But who have been those giants that you've stood on the shoulders of?
Well, there's been a lot of period. Obviously, when you're in university or in chiropractic school, there's a lot of teachers that you have. But in terms of coming out, I was in the active release community for a long time. Highly respect Dr. Michael Leahy. I actually helped to teach active release for almost 11 years. Great technique. Did some work with Tom Hyde with the Factor Group. Great person. And looking at his material that he's put together, just incredible. But I know when I spent the time with the Stuccos in Italy, it was incredible actually working with Antonio and looking at some of the work that they're doing with Luigi and the dissections they've done. I've learned so much from all of these people. I could name half a dozen people, but in reality, you take some from one area, some from another area, and they all build on each other. So I've had a lot of mentors over a period of time, and I'm grateful. I'm very grateful to them.
So, and kind of following along that same vein, what advice would you now give? Obviously, having had a very long, successful clinical career yourself, having now authored a number of different books, and then also, of course, from the education standpoint, developing this incredible protocol and teaching this to the masses. What piece of advice would you give to practitioners that are just starting out, that are, maybe students that are fixing to graduate? What advice would you give them on, the best way to continue to grow professionally?
I think one of the most important things is not to gravitate towards thinking that one particular method or technique is going to solve all problems. You need to look at a larger paradigm and start to integrate a lot of different perspectives and keep your mind open. You really have to look at something and say, okay, a musculoskeletal problem, I mean, that's your primary focus as the clinician, and you're going to look at joints and soft tissue, you're looking at nerve entrapments, you're going to look at functional exercise programs. There's going to be a wide variety of things in here to grab, tools from a lot of different areas. And so when you're putting together your tool bag, realize too that, they will have a description or an idea why something works, and you get good results, but our explanation for that may change over a period of time. Research is always growing. This is the best explanation we have at this time, but that explanation is going to change. So allow evolution to take place, and try to learn as much as you can from as many people as you possibly can.
Absolutely. I think that's great advice. And is there anything particular that you're reading right now? Any books that have really, kind of been impactful for you for, the past couple of years of your career? Obviously, being an author yourself, I'm sure you're a very prolific reader, as most are. What books would you say you would highly recommend to a practitioner?
Probably one of the ones that I really enjoyed this last year is the anatomy book from the Stuccos that came out. You're right, I do read a lot. I'm probably 50, 60 books a year at least. Which is very minimal compared to my dear wife, Kamali. But get in and read the latest research that's out there. No one can keep up with all of the research at any one time. I think there's close to something like 2.5 million pages on musculoskeletal research that comes out every year, but you can get into certain groups and they will actually go through it and look at some of the best peer-reviewed studies. So besides the text, I'm also reading a lot of studies and going through it and trying to confirm that this particular author has done the research, and now there are other authors confirming his research. So I would start attending conferences. Like I said, there's the fascia conference coming up in Berlin, which is going to be quite amazing. But there's conferences all over the place. There's some of the fascia work by Schlepp from Germany, Elheim University. Some great work. Wide variety of different authors. I'd actually not just gravitate towards one, but do a sampling from a lot of different areas.
Yeah, I think that's wonderful advice for sure. Well, we are definitely excited about some of the upcoming courses. I know we have a number of different dates that we'll be posting soon for both the upper and the lower extremity courses. So thank you so much for taking the time. We're very excited about all that is to come.
I'm very excited too, Jessica. I really look forward to these courses. I think it's going to be great. Really good.
Wonderful. And I will say to anyone that's watching, definitely, make the time, make the opportunity to get to one of these course dates. They are limited, they have limited seating, but what you will walk away with is just an incredible amount of knowledge and new skills that you can implement on a Monday morning. So thank you once again, Dr. Abelson. Have a great night.
You're very welcome. Thank you.
Thank you.
For more information on continuing education courses and events for healthcare providers, log on to our website at sports-seminars.com. Be sure to click on the Events tab to see our full calendar.